basically the nose. These are the concave, superior, middle, inferior. This is the meatus in between them. Another word for the nostrils is the nares, okay? This now is your hard palate, okay? This is the soft palate, also called the uvula, okay? The other thing I didn't mention in lecture today, and I want to point out now, right here, is right there. That's the opening of the Eustachian tube. That's where the Eustachian tube opens into the back of the oropharynx. And what's not on this model, but is maybe on another head model, is the, right back here, is the nasopharyngeal tonsil, the adenoid, okay? And that is why when children have middle ear infections continuously, they get tubes put in their ears, but one of the reasons they're getting middle ear infections is the Eustachian tube is being blocked from draining by the adenoids, which are swelling up. So if you put tubes in the kid's ear and it still doesn't work, the next thing they'll do is remove the adenoids, okay, because that's what's blocking the base of the Eustachian tube, okay? So here's the pharyngeal, the adenoids right there, okay? And then, so oropharynx, nasopharynx, which, by the way, part of the swallowing reflex, when you swallow, what happens is when you put food on your tongue, okay, you don't realize it as you're swallowing, but in order for us to swallow something, you have to flatten the tongue at the front, raise it up at the back. As that food comes up over the top of your tongue, it touches the uvula, and causes the uvula to flip up. The uvula flips over here, and that causes the swallowing reflex. The force of swallowing would force the food right back out your nose if this thing didn't flip up, okay? And by the way, people snoring is being caused by that uvula vibrating. That's what's making the snoring noise, okay? They're doing surgery for that now. I don't know how successful that is, okay? All right, so we then have your epiglottis and your glottis. We have the larynx model for this, okay? So that's all there is there. And then on the larynx, we've got the hyoid, okay? We've got the thyroid cartilage. We've got the cricoid cartilage, okay? This is your thyroid gland, okay? You should know it. I don't think we'll ask it, but that's where your thyroid gland is. Some people have thyroid problems. Hashimoto disease, you hear of. Hashimoto is an autoimmune problem with the thyroid, okay? So we got the other cartilages. You have the epiglottis, okay? And you have the arytenoid, that's this one, and this very little one right at the tip there, little tip, that's the corniculate, okay? So arytenoid and corniculate, cuneiform you don't have to know. These are the vocal cords. This is the false vocal cord. The superior one, this inferior one is the true vocal cord, okay? We then have the trachea, okay? And this brings us then to this model, the lungs. This is the left lung, 2 lobes, okay? Oblique fissure. Here we have transverse fissure, okay, inferior lobe, superior, middle, inferior lobe, okay? And then on this model, we have the bronchi. So we've got the primaries here, okay? Primaries, and these would be secondaries, okay? This model's incorrect, it's showing that as a secondary, so we got secondaries, and then down here in the lung tissue, these would be tertiaries, okay? Don't forget the blood vessels, which is the artery, which is the vein, okay? I won't insult your intelligence by telling you what it is, because I know everybody knows what it is, okay? Okay. And we have the diaphragm, okay? All right? There you go, piece of cake.